All right, so we will get started. So welcome everyone, and thank you for joining us today. I'm Christina Polito. I'm the founding principal of Compass Workforce Solutions. I'm very pleased to be partnering today with our premier security and background drug testing partner, Integras Intelligence. We have worked with Integras for many years due to their knowledge and depth of experience in their industry. We will be presenting this webinar in two parts. So the first part will be presented by Farhad Razak, President of Integras, and then the second part of the presentation by my colleague, Jane Tucker. We are, of course, all of us are adhering to social distancing requirements, and Jane, Farhad, and myself are each in a different location. In the middle of the presentation, you will notice we will be making a handoff on the screen sharing from Farhad to Jane. So don't be alarmed. We've practiced and we feel quite confident we will be successful. Please also understand that the content that we are presenting today is current as of today. As we are all aware, this situation is tremendously fluid, and we are continuously evolving our practices as we learn more about the COVID-19 virus and in step with the Federal Department of Labor, New York State Department of Labor, New Jersey Department of Labor, the CDC, and local health departments. Everyone who registered for the presentation will receive a copy of the slides, and we will also be providing helpful checklists. Please use the chat box. If you hover over the bottom of your screen, there is a chat box. You can send your questions, and we will take time at the end for a few questions, but we will also make sure that everyone has our contact information so that you can follow up with us on any fact-specific questions as they relate to your organization. Thank you for joining us, and Farhad, please take it away and get us ready to return to work.
Thank you so much, Christine, and thank you all for joining us and taking out a part of your day to learn a little bit about what we have to say. Just to kind of talk about what I will be discussing today, I'll tell you a little bit about our firm, talk about general considerations for reopening, assessing your needs, performing a gap analysis to determine what it is that your organization needs to improve upon, and then filling the gaps and creating a plan for reopening. So Integras Intelligence was established in 2007. We have professionals with diverse backgrounds, most notably law enforcement, FBI, the NYPD, the United States Secret Service, amongst other law enforcement agencies, but also the private sector. So that's security and investigations, financial, corporate America. And I think the combination of the unique backgrounds that we have position us to fulfill our clients' needs and help them with mitigating their risks. So our services primarily are about risk mitigation. So at the core, it's background screening and due diligence services. We also do investigation and all types of investigations and TSCM services, which are bug sweeps. And then we have a pretty notable security consulting practice where we've helped many, many organizations over the years with crisis preparedness and response. And our experience, many of our team members were involved in different capacities in different organizations with the September 11th tragedy. And so we have a unique sort of way of experience with this sort of thing. And we thought a few weeks ago about, what it is that we are currently doing that perhaps we can do a pivot and help our clients with the current issue at hand. And that's how we came up with these COVID-19 initiatives, is basically saying, okay, well, we are doing security consulting and doing assessments and providing recommendations to organizations throughout the world on how to properly take the necessary measures to protect their people. Well, this is similar in terms of the thought process. It's just different in terms of the things that we do. So that's how we get to this point. So let's talk about some general considerations for reopening. I think we all realize that basically the entire world was unprepared for this pandemic. And so one of the things that everyone needs to think about is, do you have an infectious disease preparedness and response plan? If not, that's something you need to begin thinking about immediately. And if you have one, you need to reevaluate it based on everything that you've learned so far and everything that we're going to learn in the future from this. And you know, it's recommended and it's required that you have this sort of thing. So next thing is, I want to make it clear, there are no experts, quote unquote experts in this. This is, as Christine mentioned, a fluid situation that's developing and constantly changing. And we are not claiming to be the experts. What we are doing is basically taking information, talking to our clients, talking to other organizations, and trying to basically condense the information into a usable format for our clients so that they could begin addressing their unique needs. Everyone needs to educate themselves, seek the proper assistance, and make the best possible decisions for your organization. So, and as we all know, I saw the participant list on this call. It's all walks of life, and you know, all of our needs are different. All of our resources are different. So there is no one size fits all. You have to assess and decide what's right for your organization. So I'm sure you guys are familiar with the term duty of care, but essentially what that means is that we all have a responsibility as employers, business owners, etc., to take reasonable steps to protect our employees, whether it's in the office, whether it's during travel, or whether it's in the middle of a pandemic. You know, liability, there's been a lot of discussion on the news with the government and privately about liability. Obviously, the government is exploring the possibility of eliminating risk for employers in terms of their employees getting ill or contracting COVID-19 as a result of reopening. I think, you know, the thought process is obviously to encourage folks to reopen when it's appropriate and reduce the scare of being liable for folks getting sick. Regardless, liability or not, I think we all share, and that's why we're on this call and we're having these conversations, the need to properly safeguard our people. And beyond liability, there's reputational risk also. And so I think we all know what that means, and it's something that we have to be careful of here. Remember that ignorance is absolutely no excuse. You know, not knowing things does not excuse you from what you're responsible for. So, you know, make decisions with your eyes wide open. You know, I've had the good fortune of talking to a lot of different people as this thing has progressed. And, you know, I think we're learning pretty quickly how involved this is. And you'll look, even if you decide that you can't do certain things, know that you're making a decision not to do it. Don't just pretend like it doesn't exist and hope that everything turns out okay. Obviously, there's a lot of regulations, guidance, and enforcement that's out there. It looks like OSHA is taking the lead in terms of all of these things, but CDC is playing a role, the EEOC is playing a role, and then obviously your state and local governments. In fact, we just saw an article yesterday in Maine where a barbershop, and you know what's going to happen here is people are going to make complaints. It's going to be your employees, it's going to be co-tenants, it's going to be people that just observe things to OSHA, which is going to respond and take the appropriate action. And so at a barbershop in Maine, we saw an article just yesterday about 3 complaints going in that they're not following the proper protocol. And of course, OSHA responded. And so things like that, obviously, you have to be aware about. Third parties. So remember that everything that I'm talking about here, you should really be also thinking about third parties, visitors, contractors, anyone that visits or does business with you or interacts with you in your environment. It's important to keep in mind that it's our responsibility to keep everyone safe. So gap analysis, right? So what's the purpose of an assessment? I can't tell you how many conversations I've had already about people just, because early on, what happened, what we saw everywhere was that people were checking temperatures before allowing admittance. Even we saw at the airports, at the White House, that people's temperature was being taken. Obviously, it's progressed significantly since then. And so people were initially just thinking, okay, as long as we figure out a way to take temperatures, we should be good to go. As long as we test people beforehand, we should be good to go. We're learning there's a lot more to it than that. So rather than making decisions in a bubble, the purpose of the assessment is to identify what your exposure areas are. What are the strengths and weaknesses of your organization for reopening based on those exposures? You have to prioritize your needs and create a plan and timeline. So let's start talking about some of the things you need to assess. Now, everything, this presentation is not going to address every single little item, but I'm going to try to touch upon all the major items I think that is going to be applicable to most people. First thing is, do you have a reopening team? Now, I also understand that some of our organizations are smaller, and you know, all of these, that there may not be all of these different roles that exist in your organization. I mention it because even if a person doesn't fill these roles, the people that are part of this team have to wear these hats and think about these different things in order to address reopening. So who's going to be involved? It should be a multidisciplinary team from your C-suite, HR, risk management, legal, security. And again, even if you don't have people that fill those roles, you should be thinking about it. Chain of command. I mean, there should be a clear chain of command, decision-making authority, capability, all those sorts of things. Roles and responsibilities should be clearly identified and communicated to everyone involved. And then you have to determine what gaps there are. If you're not able to fill all these things, do you need to go to external resources or organizations to help fill some of the gaps that you have in your organization? Next one is stating the obvious: know your federal, state, local mandates. Now, knowing it is like a full-time job. So does your organization have the capability to stay on top of this? If not, do you need help in doing that? Monitor development. So again, I'm just listing a few here in terms of developments that you may want to keep track of, but you know, does your organization have the capability, besides spending 2 minutes or 5 minutes or 10 minutes at the beginning of the day or end of the day watching the news or scrolling the internet? If you don't, that's something that you're going to want to consider, because this is a dynamic situation that's going to keep changing. So I'm going to just briefly touch upon human resources. Jane's going to address that more in depth later, and she's not going to talk about every single one of these items, but I'm just mentioning it for the purposes of the discussion. So one of the things everyone needs to do is an analysis from that. You know, once you have the team in place and those other things in place, you have to do an analysis of, you know, your workforce, who needs to come into the office and who can continue working from home. I think basically the guidance is that this is going to probably last for a while. There's scares about a resurgence and things like that. So people that can work from home, where it doesn't impact the business's operations, should probably continue to do so. If they can't, those are the people that you need to identify, and that's going to impact everything else that you decide that we talk about. You have to think about your policies. Do you have a sick leave? Do you have a work from home policy? Do you have wellness plans? Do you have a return to work after exposure, infection? Do you have a plan for visitors? You have to sort of get all of these things in place, because you don't want to find out later after you put things into action that you don't know what to do. Also, you don't want to make inconsistent decisions, because I think there's a lot of concern about privacy and liability and all those sorts of things, and you want to be consistent in your approach. So employee schedules, can to avoid risk or exposure, can employee schedules be staggered? Can there be alternating days when people come in to the office or work environment? What about travel? Is your organization going to be required to travel? If so, what do you need to think around that? Consequences for not complying. I mean, this is something that, again, I think we're all looking to get back to work. Everyone's anxious. I'm anxious to get back to it, because all of our businesses are being impacted by it. Our lives are being impacted by it. But, there's simple things like, okay, well, what do we do if someone doesn't comply with the guidance that we're giving them? You have to think about that ahead of time. And then obviously confidentiality. We're starting to talk about things that are traditionally, you're not supposed to share. So when you do a test and someone doesn't show up to the office after they were standing on the line getting their temperature checked, I think everyone's going to be concerned about why they're not there, and, things like that. So these are all considerations that you have to evaluate. Is your organization ready for all these things? If not, what do you need to do to get the organization ready? Communication is one of the biggest keys to any crisis situation. You have to communicate with everyone involved, whether that's internally to the reopening team, whether it's to your employers, whether it's external vendors, and you have to evaluate if your organization is ready to do all those things. Because again, like I said before, the last thing you want to do is reopen and realize later on that you're not prepared for these things. Training, and that kind of goes in line with communication. All of the things that are being put into place, you have to be prepared to train appropriately based on position, based on roles, all of the new measures that are being taken. So keep that in mind. Are you prepared to do that? Not only initially, but on an ongoing basis. And you have to document everything. I think, this goes back to the idea of, liability and all those sorts of things, but also just as a positive thing, document everything as a means of being able to talk to your superiors, the shareholders, about what the organization is doing to keep everyone safe. So some general considerations that you have to think about is, as far as your assessment. If you're in a property where there's a building or property manager, are you coordinating with them? What's the plan? Do you have a plan for initial, ongoing, and high-touch surface cleaning? If not, that's something you need to figure out. Are there sanitizing stations appropriately placed throughout the facility? If not, that's something you need to consider. Do you have the supplies currently, and do you have the pipeline to continue supplying? And that might be through your cleaning company or whomever. So that's something you need to sort of consider. Touchless receptacles, office configuration. Again, I think we're going to need to properly social distance until we find a vaccine. So is the configuration in a way that's going to be able to allow for people to do that? Do barriers need to be put up? No sharing of equipment and workspace. Again, that's generally in this environment frowned upon. And is your organization able to do that? If it's not, what measures do you need to put into place? Signage. Obviously, this may not be the most beautiful thing in the world, but there has to be appropriate signage throughout the facility and to notify people about proper social distancing, maximum number of occupants in a conference room, in a bathroom, things like that. So, you know, that's something you need to consider. Do you know your standards, and then do you have the ability to put the signage up and, again, let people know? Security needs. Are there, as a result of some of the measures that you might have to take, are there security needs that you have to address? If so, do you have the capability and resources to be able to do that? Last thing in this section is internal contact tracing. Again, we've heard a lot about this on the news, and I could probably do an hour on this, but it's just something you need to consider to help avoid the spread and identifying, you know, the exposure and all those sorts of things. I think, you know, one of the things I failed to mention at the beginning is that, you know, this is a situation where really everyone has responsibility to keep everyone safe, right? And so the government's doing their part, private organizations are doing their part, but we as individuals also have a responsibility. And the contact tracing is going to be a big help, I think, to prevent the spread. So again, the other things that I'm going to sort of quickly go through here is, you know, access, egress, hallways. You know, you have to think about return to work testing, which has been approved. You know, are you going to do that? How are you going to do that? Who are the resources that you're going to use? What's going to happen if someone tests positive? What are your policies? Those are the things you have to think about. Pre-shift screening, again, how are you going to do it? Who's going to do it? You know, there's people doing temperature checks. Others are doing self-certification, you know, written, oral, where they're saying, I don't have all of these symptoms, things like that. You have to think about policy for refusing entry, communication of that policy, confidentiality, responsibility, and all the challenges. I mean, all of these things seem to be pretty simple when you watch it on TV, but when it's your organization and you're thinking about how you're going to handle it, it becomes a lot more difficult. You have to think about the contact points and cleaning. I touched on this earlier. Sneeze guards at reception desks, security desks, things like that, or even within the offices if need be. You have to think about the reception security desk. Is there proper distancing? One directional hallways to avoid people crossing paths. Is that possible? If not, what are the alternatives? Again, hand sanitizer stations, signage, which I touched upon both of those things earlier. Common areas, right? Conference rooms, restrooms, break rooms, mailroom. A couple of the things about that is, you know, again, there's probably going to be a phased reopening even for companies as they sort of build this. And so a lot of people are asking questions, should we even keep it open during the initial phase until we know that we have a better handle on this? That's something you have to consider. Is it possible? Can doors be propped open? Can we implement automatic doors? What's the maximum occupancy in all of these places? How do we enforce that? Proper seating, sneeze guards, hand sanitizer stations, signage, floor markings, right? Floor markings as in 6 feet apart on the ground, as many places have done already, right? So again, I'm going through a lot and I'm condensing it as much as possible to try to get you as much information as I can. All right, so now you've sort of identified all the gaps. What's next? Keep in mind that this is a project. Ensure that there is some sort of project manager and the appropriate supporting staff. I realize that, again, as I mentioned earlier, that some organizations are larger, some are smaller. Even if you don't have individual people that can be assigned all these different tasks, you have to think about it with this mindset. So what were the gaps that were discovered, right? You have to prioritize the importance of the changes that are needed. You have to create a plan, a timeline, and assign specific duties for implementation. You have to monitor progress and reassess as needed. And then, of course, communication and training, right? So that's going to be involved at every step of this process. And then just the final thought for everyone. Properly assessing, planning, and executing a reopening plan is going to take time, it's going to take resources, and it's going to take patience, right? And as I mentioned earlier, it's all of our responsibilities to get the country and the world back into a normal state, which is probably going to be a different normal state, but it's all of our responsibilities. And it's just, this is the reality that we're in. And so, and I say it doesn't stop here, because even after we reopen, it's monitoring compliance. It's, you know, are changes required? What's the new news? Are there new symptoms? Are there new concerns? So this is going to be ongoing. As Christine mentioned, we're going to send you a copy of the slide deck, and you'll have our contact information, but that concludes my portion of it. So I am going to turn this back over to Christine to turn it over to Jane. Thank you very much for having me.
Thank you so much, Farhad. This is Christine. I will just share a little bit with you about Compass. I know many of you are existing clients or have known us for quite some time. So during the COVID crisis, we've really been supporting our clients in helping them transition their employees to remote work environments, helping them to furlough or lay employees off, addressing compensation questions like salary adjustments. And now, fortunately, we're starting to be able to return people to work in some of the essential employers as construction picks up. We've been involved in designing processes and procedures to address employees that may test positive for COVID-19, helping companies to understand their leave requirements and managing FFCRA leave and integrating it with other employee benefit programs that they already have. And then on top of that, kind of putting in place employee communication pieces, whether it's emails, phone calls, or also letters and records. So we have a 10-year track record of success. We've been servicing all of our clients with service delivery teams. Our clients have access to us in off hours, which over the last few weeks has proved to be very beneficial to them. And we have a culture of training and investment of all of our people. So we're well positioned to help you. If we can be of assistance, we're happy to do so. So Jane, go ahead and continue on and get us ready to go back to work.
Okay, thank you, Christine. All right, so I'm gonna focus on talking about the issues specifically regarding bringing your employees back to work or not, depending on the circumstances. So we'll talk about determining which employees to bring back to work and when, responding to employees who say they cannot return to the workplace or do not want to, considerations for remote work, and wage and hour implications of making changes in pay, hours, schedules, job duties, etc. And then we'll go to our question and answer part. Okay, so determining which employees to bring back to work. You know, this is where you start the process, and what, you know, I think is important to remember is that just because you can bring your employees back at some point, right now, most of us can't, but when you're told, okay, you can bring your employees back to work, that doesn't necessarily mean you should. And so you should start, you know, your analysis there and thinking about, well, what makes sense and what doesn't. And one thing that is a good idea that you may want to start with before you do this, before you reopen, is starting with an employee survey to ask your employees to take, you know, their quote unquote temperature about returning to work. Are they ready? Are they willing? Are they able? What are their concerns? You know, and that way you can address them. What are their work-life balance concerns and issues? You know, do they have children at home who they have to make arrangements for? And what are the other issues? And that's obviously the best way to prepare yourself to be able to respond to those concerns and questions when you're preparing for the workplace to reopen. determine which employees are legally permitted to return to the work site. And what we mean by that, obviously, is that it's going to depend on what the local, state and local orders say. I mean, for here in New York, we've been hearing from Governor Cuomo that, he's not even considering anything opening until May 15th. And then at that point, he's talking about various sectors opening. He's mentioned specifically manufacturing and construction first. And even then talking about a regional approach where I have a feeling more will be happening upstate than it will be down here in the New York metro area. So obviously you have to determine who is legally permitted to be in the workplace. And then identify essential business functions that need to be performed on site. So this is what I think, as I was saying just a moment ago, just because you can reopen doesn't mean you should necessarily rush to get everybody back into the office just for the sake of saying, hey, we're open, look, we're all here. Because that's not necessarily the best way to go. You're going to have employees who are resistant to that or for various reasons cannot be back. And I think what we've all realized in this time is that even for businesses that never had any remote work in place, this hasn't been so bad for everybody. For some businesses, this actually has worked out well. And if it can continue in some way or to some extent, that obviously will minimize the exposure people have to one another and the concerns about spreading this virus. So really think about what has been working well and what hasn't. What parts of your business have really been negatively impacted by the inability to be in the office face-to-face with one another? And then that should guide how you decide who's coming back and who's not. Who needs to be there to get the job done well? And then go from there. And then, review and revise your job descriptions and org charts as necessary, because you'll probably be making some changes in people's job duties. You may be, spreading job duties over several different people who are going to be in the office versus those at home. You may be shifting certain job responsibilities temporarily, and you should document those changes and have employees sign the new job descriptions, so there's no argument later that they didn't understand what their new job responsibilities were. And also, again, any organizational structures, reporting relationships that change, you want to document those as well. So responding to employees who say they can't return to the workplace. This is definitely the number one question that I'm getting, Christine is probably getting as well. Well, what do I do with people who say they don't want to come back or they can't come back? And how we've been approaching this with advising our clients is that you kind of have to walk through a series of steps to figure out what is the issue, what is the real reason why. So, you start with the obvious. First of all, okay, is the employee sick with COVID-19, experiencing symptoms, has a medical diagnosis, or has been ordered to self-quarantine by a healthcare provider or the local health department? Obviously, that person's not coming back. And in fact, they may be entitled to certain types of paid leave, such as the Families First Coronavirus Response Act, which is the federal law that provides emergency paid sick leave. So for up to 80 hours of paid sick leave for people who fall into one of those categories above. So, you may need to be providing them with that type of paid leave. There may also be applicable state laws, such as the New York State COVID-19 paid family leave, which, as opposed to regular paid family leave, which doesn't apply to the employee themselves, this does. And there may, if you have over 50 employees, you may be subject to the Family and Medical Leave Act, and therefore may have to have responsibilities as far as granting FMLA leave. So that's the first question. Next question, okay, well, does the employee need to care for a family member who is sick with COVID-19, has tested positive, ordered to self-quarantine, etc.? Again, the same provisions may apply. There may be, certain leaves that they are legally entitled to. So you have to, pause there and figure that piece out of it. The next question is, does the employee need to care for a child whose school or daycare is closed or whose childcare is otherwise unavailable due to the COVID-19 crisis? Again, the Families First Act provides for certain types of leave that employees can take for this reason. So again, as you can see, we're sort of walking through the possibilities to figure out where we are. Next, does the employee have an underlying health condition that puts that employee at increased risk from COVID-19? So this is an interesting area, right? This is a gray area for sure. And it's something that you're going to have to look at on a case-by-case basis. It is possible that an employee may qualify for a reasonable accommodation of a disability. If they have an underlying health condition that qualifies as a disability under the ADA or state or local human rights laws, and that's something that they can medically document, then it may be a reasonable accommodation to allow them to work from home. And that, again, would be something we'd have to look at on a case-by-case basis, and you would have that legal responsibility to engage in the interactive process with the employee to figure that out. Next, does the employee live in a household with family members who are in a vulnerable population or have underlying health conditions? I've heard this, used as a explanation for why some employees are concerned about coming back. But there really is no legal basis for saying, you know what, I live in a household, I'm afraid that I'll contract it and I'll come back and I'll expose someone in my home. If they're actually responsible for caring for someone who's sick, that could be something that's covered by one of the leave laws or something like that. But just a generalized concern about that, probably not going to be a legally protected reason to not come back to work, but something that you want to obviously work with the employee on, address how you can mitigate their concerns. And of course, all the safety precautions that you're going to be taking based on the types of things that Farhad was describing will hopefully allay some of their concerns about that. Next question. So now we're sort of like we're moving from the very clear-cut reasons to the ones that are living in the gray area. Is the employee part of a vulnerable population? So what if you have employees who are older and who say, well, I'm worried, they say that if I get sick, there's much more of a chance that I'll end up in the hospital, I'll end up, needing a ventilator, something like that. So I don't want to go out there. I mean, I think we've all experienced that even in our personal lives with, our elderly family members or whatever, we're making sure that they're all, wrapped in a bubble and protected. Well, can they now say, well, I don't want to come to work? And the answer, again, it's a gray area. It's something that you need to work with the particular employee on, but there's no legal requirement or legal right that they have to say, I'm not coming to work because I'm part of the vulnerable population. If you as an employer are providing a safe workplace for them, then they should be able to come to work. That being said, if there's a way for you to work with them where they may be able to continue working from home, this is where I get back to the fact of there's no reason to make everybody come in if they don't have to come in to do their job. And that's where this is one of those areas, I think, where you would be weighing those considerations. And then lastly, let's say none of the above apply, but the employee is just afraid to return to work. And I think we're going to hear this a lot, right? If you haven't already, they're just worried. People are scared, understandably so. So what do you do about that? What do you do about the employee who's just scared to come back? First thing is you have to, and you're not, none of us are, I assume, psychologists, psychiatrists. We're not, well, some of you maybe, but we're not, supposed to be making a diagnosis as to what is, clinical anxiety versus what's just a generalized fear. And you don't have to go there unless the employee brings that up to you. So I did have a client recently who had an employee who said, the COVID-19 crisis is exacerbating my existing anxiety disorder. And they had a note from his treating psychologist stating that. And so now you're getting into ADA territory, right? Now you're getting into a disability and how to accommodate that. That's different than someone who just has a generalized fear. And you don't want to be in the business of figuring out which is which, who falls into which category. So you go with the assumption that it's a generalized fear And you're going to allay those fears by communicating very clearly to your employees all of the things that you're doing to keep them safe in the workplace. And then if, you know, it's up to them to then come back and take it to the next level if they want to. And of course you want to be empathetic. Obviously, we're all scared. We understand, and you want to make it clear that as an employer, you understand their fears, but you want to reassure them that you are doing everything possible to make the workplace as safe as you can. So again, create a plan to address those fears and concerns with regular communication of all those steps that you're taking. Make it very clear what you're doing. Then, you know, things like the signs being up in the workplace and all of that. I saw someone ask already, well, what do we do about people who don't follow the rules? Well, those people should be disciplined. They should be held accountable. This is not voluntary. These are the rules that we're putting in place to keep you safe in the workplace, and you need to follow them. You need to follow them because they're rules, and we always follow work rules, but also because it's the right thing to do. We're all in this together. We keep hearing that phrase, to protect one another and keep each other safe. And then lastly, you know, I mean, if all of this fails and the employee is just saying, I'm not coming, I can't do it, I don't want to do it, you could then say, well, then you are choosing to resign your position, and they would be terminated. You know, that's certainly not where you want to go right away. You want to try to avoid that if you can. But, you know, if you get to that point where you've done everything you can and they have no legitimate explanation for why they can't come back to work, then they are choosing to forfeit their position and to abandon their position. And then I just want to touch on the unemployment benefits issue, because we've heard people say, you know, employers express concern that with this additional money that's being given by the federal government, the $600 unemployment supplement, that for some employees, there's no incentive to return to work because they're making more money being home, right? I'm sure a lot of you have heard that or have that concern. And what you should know is that, you know, and something that you might want to, you know, share with an employee in a polite way is that once you offer them the ability to come back to work, they're technically not entitled to unemployment anymore. And you will be notifying you will be letting the unemployment department know that you've offered this person work. You have given this person the opportunity to return to work, and therefore they should not be receiving unemployment benefits anymore at that point. So you might just want to, you know, drop that into the conversation somewhere to make sure people are aware that that's really the way this is supposed to work, that you're not just going to stay home and collect money when there is actually a job for you to do. So considerations for remote work, I just wanted to touch on this. You know, I'm guessing this is something that most of you are already doing, but some of you may not be. But so just the things that you want to make sure you have in place if you are allowing employees to work remotely. Well, first, create a policy and a procedure for responding to requests to work remotely. You don't want to be doing this on a one-off, inconsistent basis. You want to have a policy, a procedure, and guidelines in place for how you grant requests to whom, under what circumstances, etc. Otherwise, you could, you know, open yourself up to claims of discrimination and of, you know, favoring certain people in certain groups, and you don't want to do that. And that's sort of the second bullet here is just, again, when determining which positions and employees will be eligible to work remotely, be mindful of discrimination against certain groups, such as the elderly or pregnant workers. You know, you don't want to make assumptions about people and what they can and can't do based on their membership in a protected class. You know, I had one employer ask me, well, can I just tell all the elderly employees to stay home? And the answer is no. You can't, and actually the EEOC has guidance they've issued on that. You can't just decide that people in a certain group should have to work from home. Now they may want to, and that's another story, but to mandate it because you feel you've made the assumption that because of their membership in that group, they should not be at work. That's not okay. So again, you want to use objective measures, looking at job functions, decisions. If you have to decide between employees, perhaps seniority, merit, performance, things like that, that you can document and support if asked to defend your decisions. And then you want to develop a remote work policy. Make sure you have one of those. If you don't, that's certainly something we can help you with. And an agreement that you have the employees sign. We usually have our clients use some type of agreement that just spells out what all the expectations are for someone who's going to be working remotely, and makes it very clear that if an employee is not living up to those expectations, the remote work arrangement could be revoked. So that's important to have that. And then consider related issues that come along with remote work arrangements, such as IT. Does the employee have the tools that they need to work remotely? Do you need to be providing them with a phone, a laptop? What's happening with their internet access? I know that there are some employers who have chosen during this time to reimburse their employees for a portion of their internet access that they pay for at home. Not something you're legally required to do, but that's certainly a nice thing to do. So what are their IT issues, and how do you address those? Timekeeping can be a really big issue, especially when you're dealing with non-exempt employees. So employees who are paid by the hour, employees who you should mostly, although some can be salaried, employees who for whom you should be tracking hours and who you should be paying overtime if they go over 40. How are you doing that from home? How are you making sure that they're tracking their time, that they're keeping to the hours they need to be working, etc.? Make sure that you have policies and procedures for that. And then also performance management issues. There have been all sorts of you could do a whole separate webinar on how do you manage remote teams. There have been a lot of those, actually. So think about that. Do your supervisors and managers need support to do that? Have they ever done it before? Do they know how to supervise or manage a remote team? And what do you do when there are performance issues or performance concerns that you have about an employee who's working remotely, and how are you going to handle that? Definitely also something to consider. Okay, and then lastly, think about the wage and hour implications of any potential changes that you're making for pay, hours, schedules, or job duties, all of the above. So evaluate the need to reclassify any exempt employees to non-exempt. So if you've reduced someone's pay, for example, in New York State, if you've reduced their pay below, I believe, $52,000 and change right now, they can no longer be an exempt employee. In New York City, it's higher, it's $58,500, I believe, right now. So if you've reduced their pay below those thresholds, they can no longer be exempt employees, which means while you still may want to, you may still pay them on a salary basis if you want, you have to start tracking their hours, and they have to be paid overtime, obviously, if they go over 40 hours. And also if you change their job duties, right? So we all know that exempt employees, in order for an employee to be exempt, they have to meet there's two tests. There's the salary test. Do they make the minimum amount? And what are their job duties? So if you're changing people's job duties, make sure that they still meet the duties test to be exempt. When you make changes to people's pay, make sure that you prepare and distribute any legally required notices. So for example, in New York State, there's the Department of Labor wage notice that has to be given to employees. And you have to give employees at least 7 days advance notice of any reduction in their pay. So be aware of that. Identify and address potential off-the-clock work issues. So what we're talking about with that is, are there things that you're going to be asking your employees to do that they're not getting paid for this is, a trap that sometimes employers can get into, that then they get in trouble because they're basically having employees do off the clock work. So just be aware. So for example, if you're having employees check their symptoms at home or take their temperatures at home, or, fill out a questionnaire, if they have to come to work and stand on a line to get their temperature checked, when are they getting paid? Are they getting paid when they get to their desk? Or are they getting paid for the time that they stand on that line to get their temperature checked? I would argue it's the latter, obviously. And what about time for putting on PPE or for cleaning their tools, cleaning their workplace, cleaning their desk at home, at work? All of that stuff should, if it's required by the employer, should be considered work time and paid time. Non-exempt employees, if you are doing COVID-19 testing, which is a whole other can of worms that we can talk about whether you should or shouldn't be, but if you are, non-exempt employees should be paid for any time that they spend getting tested, waiting to be tested, etc. And then identify and address any additional meal break or rest break issues. So if employees are being asked to eat lunch at their workstations, because that's one of the recommendations for cutting down and for keeping social distancing is don't have a lunchroom anymore. Let employees eat at their desks. But now you run into the issue, particularly with non-exempt employees, of are they working through their lunch, which, as we know, is unlawful in New York State, for example, and other states as well. So what are your rules and procedures going to be to make sure that employees are still taking their meal breaks? Same thing true if they're working remotely. How are you making sure that they take meal breaks? And then lastly, consider hazard pay or shift differential pay as appropriate. Again, not required by law, could be required by a union contract you may have, but other than that, you don't have to give people hazard pay or shift differential pay, but it's certainly an incentive to get employees back to work, particularly if you are expecting them to perhaps put themselves in harm's way, if they're going to be working with the public. Maybe the people who have to, work in public facing positions are getting quote unquote hazard pay. If they have to work what might be considered an unpopular shift, then maybe they get extra pay for working that shift. Something to think about as an incentive to get people back to work where and when you need them. Okay, so those are the wage and hour implications. Lastly, just be prepared for an uncertain future. I think we all obviously understand that we don't know where this is going. We don't know how long this is going to last. So be prepared, even if you are reopening and getting people back in. Be prepared for the fact that there could be a second wave, right? We've heard a lot of talk about that. So be prepared for how you'll handle that second wave. How will you handle another government shutdown or partial shutdown where you're ordered to shut down your business? What will that look like the second time around? Be prepared for what happens if you get a lot of employees taking sick time or leaves of absence. Do you have coverage plans in place in case of that eventuality? And this is definitely the time to make sure that you have good systems in place to notify your employees, to communicate with your employees quickly and effectively. Make sure you've got up-to-date employee contact information for everybody. I guarantee you don't. Because it just doesn't happen. And we've had so many situations where we've had to reach an employee and we realize the address is wrong, the phone number is wrong, whatever it is. So now's the time to make sure you have all that information up to date and that you've established methods for communicating with your workforce quickly, and that your employees understand how you will be communicating. Will it be an email? Should they be checking some internal, internet announcement board, etc. Make sure everyone understands where they can get announcements and information quickly. Okay, and I think, yep, that is the end of my portion of the presentation. I'll hand it back to Christine.
Thank you, Jane. I think throughout the presentation, you and Farhad kind of addressed a lot of the questions, but we do have a couple that we could probably touch on a very broad basis. So one of the questions is, do we need to supply masks and gloves at all times?
Okay. Forehead, is that something you want to answer? Do we have forehead?
We should.
All right. Well,
I'm
oh,
here.
there it is.
Sorry about that. I had it on mute. No, I think the protocol for that, some of that is obviously going to be dictated by the state and local mandates, what type of organization that you have, and basically whether or not social distancing. So it's kind of a loaded question in that there's a lot of factors that determine whether or not it's required. Now, best practices would suggest that you have the PPE available in case it is needed, for sure. But whether or not people are going to be using it or not, until this is, we get a better handle on the whole situation, it's probably a good idea to have it on hand.
Yeah, and what I would add is just to say, first of all, obviously, anything that you're requiring employees to use,
right,
you should be providing. They shouldn't have to go buy it themselves. And it's probably best to have these things available so that, employees, even if you're not requiring face masks, although I think at first you probably should, if someone wants one, it's there. It's another
right.
way of showing them that you're taking the steps necessary to make them feel comfortable.
That's correct. It looks like there was another question about how do you prevent abuse of PPE, and I think the answer to that goes back to the training, the communication with people, and really with a lot of these things, it goes back to that: is what are your policies? Are you communicating it? Are you training? Are you retraining? And are you following up with anyone that perhaps is not following the proper protocol?
Well, thank you very much, Farhad. What I'm going to do is I can actually save the chat, and we can make sure that we circle back to anyone that has a super fact specific question. As we mentioned, we will be emailing out a copy of the presentation and also some helpful checklists to guide you as you make your assessment on returning to work. If we can be of assistance, please do not hesitate to reach out to Compass or Integras. We're here to help you through these challenging times. And thank you so much for joining us on our webinar today. Please stay safe and well.
Thank you, Christine.
Thank you.